Doesn't look like it has. Yeah, I think it's good. Right. Hi, everyone. Good evening. I hope you are having a good week. Welcome to the sixth episode of FCPI podcast. And today we are actually here to discuss quite an interesting topic and a topic for which both me and Rashid have been getting a lot of questions about. So we are going to discuss about various aspects of doing a PhD after both PharmD and M.Pharm degrees. So I'll be your host for the episode. So I'm Vrinda Namputri. I am currently serving as the Vice President of FCPI. I am a postdoctoral researcher at Amrita Hospital in India. I have completed my PhD in Health Sciences Research last year from Amrita University. And as the guest for today's episode, I'm very happy to welcome my dear friend and colleague, Dr. Mohammad Rashid, who's again a postdoctoral research associate currently working at the University of Utah College of Pharmacy in the US. He is currently the president of FCPI, as many of you already know about. He has completed his PhD in pharmacy practice with a specialization in pharmacoeconomics and evidence synthesis from Manipal University last month. And he's also experienced in systematic reviews, meta analysis, network meta analysis, and mixed method research. So, thank you so much, Rashid, for joining this episode and welcome you to the sixth episode of FCPA podcast.
Yeah, thank you so much, Wanda, and it's a honor to be part of this FCPI podcast where we can give more insight on the experience of PhD, and it will be obviously useful for many people, those who are planning for their PhD.
Start off with a very, very basic question, which is who should do a PhD? Or when you're thinking about doing a PhD, what are some of the criterias, or how do you decide whether you are in a position to do a PhD or not? So I think we could start from there. So to just begin with, for me, PhD was not planned. When I completed my PharmD in 2016, I never planned to do a PhD after that. I was interested in doing research, but I did not have the right guidance and I did not know how is it that I could work in a research. I mean, I could have like a research career, and PhD was never in my agenda. So I enrolled for PhD because my mentors actually motivated me to do it. So I started loving research more, and I enjoyed doing a PhD through the course of my PhD journey. So, for me, if you ask, I would actually say if a PharmD or an M.Pharm graduate wants to really be in the clinical space and have a career of like a proper clinical pharmacist, I wouldn't suggest doing a PhD as the first option. I would rather recommend to do like a board certification or some clinical specialization instead. There's no harm absolutely in doing a PhD, but I would actually encourage them to do a board certification as the first priority. So what is your perspective on it?
Yeah, as you mentioned, if you ask me like who should do a PhD, the best answer is who is in need of a PhD. Okay, so that's the best answer which I could give. And yeah, you can do PhD in any stream. Okay, in the earlier days, I myself was believing PhD is something like to like height to reach there, but then slowly as we progress during our academics, as we complete our postgraduate, we'll get to know a sense whether we should choose a PhD or we should go with anything else. So PhD is not, as you mentioned, it's not always the first priority, but it will become a priority when that is your requirement or when you want to learn. So it's depends on the requirement, it depends on your personal preference, or it can be like your professional preference. Okay, so okay, for me, I want to be an academician. I want to work with the academic research. I want to be into the getting the uh, new ideas, getting new things to be done. So obviously, I have to complete my PhD. So the next question is that what is the need of me being a PhD? Okay, so if you ask me personally, one thing is that okay, I want to serve the community. I want to give something back to the society through my research. Okay, then only I can definitely think which area I should work for my PhD. So that is one part. Second part, okay, if you see your professional journey, okay, you want to become maybe a director of a company or maybe which focusing on research. Okay, obviously you need a PhD there. So that time your PhD may not be like how we choose. It may be something like you do a part-time PhD or you go with a affiliated university or so. Okay, you work sometime there, sometime here. So there's that kind of part-time PhD you can prefer. So who should do PhD? Basically, my answer is who is in need of PhD. Second thing is that what you should do in PhD, what will help you in the future, depends on your preference. So that might be the best way to do PhD. When it comes to look at our topic is more towards M.Pharm and PharmD. Okay, if you are a PharmD graduate, as you mentioned, your first preference will be mostly always towards the clinical pharmacy or anything related to the clinical. Okay, so as you progress, okay, you are realizing that you want to acquire more knowledge, you want to acquire more clinical or I could say research-oriented knowledge, then obviously you need to do a PhD in specific area so that you will get to know more in that particular. Okay, you are more interested in cancer and you want to grow your field in the future in the cancer research, oncology research, so obviously you need to do a PhD in oncology. So that will build up your professional journey, but that will build up your career, that will build up your CV. Then you can take all your road towards that. So that is the one part. When you come to the M.Pharm, obviously M.Pharm is having a lot of other area also to focus, maybe regulatory affairs or many other things also. So even the same concept apply the they want to pursue something great in some area, then you need to focus in that particular area and do the PhD in that. So that might be the basic set of who should do a PhD and what is the need of doing a PhD.
Yeah.
Yeah, I
Yeah.
think if I miss anything, you can
No,
further
no,
add.
I completely agree with what you're saying. And I think just as a follow-up question to that, for me would be that I usually get is when is the right time to do a PhD? So once you
Mhm.
graduate, is it better to do a PhD right away, or is it better to just maybe work for some time and then do a PhD? So actually, I usually say there is no such right time to do a PhD. It again depends on your personal needs and your personal commitments. But just my very, very personal opinion is it's better to do PhD maybe like after working for a year or two, so you understand what is it, where is it that you are interested in? Is it you want to, do you want to be invested in research, in academics, or do you want to do clinical work? So just because the first 2 years is like very formative years of your career, and that's more like trial and error. So I would say it's always a good option to just maybe wait for the first 1 or 2 years, just try out different areas, and then if you really feel that, okay, PhD is the next most appropriate step for me, then go for it. Because PhD is a long-term commitment. It's not like you complete your PhD within 3 months, 6 months, not even a year. It can go up to years and years. So I would say that this is my very personal opinion. Rashid, you can differ, but I would actually say maybe it's better to just wait and then get enrolled for PhD. What do you think?
Yeah, I'm completely 100% agree with you what you said exactly. So as we mentioned in the first part of our discussion, so you should know the need of your PhD. Okay, so
Exactly.
whoever asked me about the PhD, so I will say like in my own language, I mean common word I used to say them that it's like you are jumping into a pool without knowing the swimming. Okay,
Hmm.
you know how to swim just theoretically, but you don't know how to swim practically, and you are jumping into a pool without knowing that. So it's all about that, the PhD whole experience. Okay, it may look see it in the initial days, but as you go further, you will
Yes.
get to know what is
Yes.
exactly a PhD. And it's a, as you mentioned, it's a long-term commitment. Like our sometimes our professors, you might have heard the same thing. Our professors will be saying that PhD is your second wife, but sometimes it will become your first wife also sometimes. Okay, so so it's as you mentioned, it's a long-term commitment where you will have to sacrifice many things. best part of life many times. But obviously, you will get the reward for that at the end of
Yes.
the day. If you did your PhD with wholehearted PhD, so you will get the reward. You never regret for that. The earnings, the learnings, whatever
Mm.
you get out of it. Okay, so then, okay, as you come back to the point which you mentioned, take a break, then get into PhD will be the best if you can.
Yep.
But okay, obviously you did your post graduation or PharmD with a good professor, and he is immediately offering you a PhD. No doubt, go for it. If you
Mm.
are in good term and it is
Mm.
very good for
Yeah,
you,
yeah,
and you feel that
absolutely.
there is a. Otherwise, even I say you, I mean, I agree with you that take a break, understand the your objective, your status in the main, I mean, financial status, because that is
Mm.
very
Of course,
important
of course.
during your PhD, because you
Yes.
are committing for your next 3 to 4 or obviously 5 years. Even there's we say that 3 year PhD, it will go minimum five
Yeah,
years.
yeah, yeah, yeah.
So you are committing for next 5 years, and that will be the best part of your adulthood life.
Mm.
Okay, you will have many
Your prime
commitments. You
years.
will have to, yeah, your best time of your life. So you are dedicating that for your PhD. So all your basic need of life should be settled. Maybe you should be financially, I can't say very strong, but you should be somewhat strong to get into the
Yes.
PhD. Plus, you need to see, you need to plan for your next 5 years how your life should be going. Not only
Mm.
your PhD, along with you need to plan your family life, all your, like, all your
Personal
family
life.
commitment and personal life, everything. So, uh, uh, when you take a break, you will have a clear path what you
Yep.
want to do or which area you want to do, instead of okay, I did my PharmD or I did my M.Pharm. So I'll have 10 different varieties of objective
Yes.
in front of me. Okay, I can do in clinical therapeutics, I can do in clinical oncology, I can do in pharmacokinetics, I can do in different parts. But you work for 1 year, that time you
Mm.
will really understand what is your strength and weakness. Okay,
Yes.
I then that time you will get to know. Okay, during 1 year you can try multiple things. Okay, you try pharmacotherapeutics and you really realize it that that is not my area of interest
Area.
which I should
Mm.
focus. But instead, you next time from pharmacotherapy, you immediately just focus the clinical, maybe pharmaco economics or something else, and you realize that you can work more. So you are really understanding your area where you want to work. Okay, so that will give you a sense that what should be your PhD, and obviously PhD will be uh, starting from where you stopped. It's not that what you are already doing, you are continuing. No, PhD
Yes.
will be one step ahead of what you are
Yes.
doing. Not only even one step, maybe 2 to 3, 4 steps ahead of what you are right now doing. Okay, so what you did during your okay, I also took 1 year break during my uh, between my master's and PhD. I had multiple aims. If I want to be open, I can be. So one thing is that, as you mentioned, I should be have a clear path. Where should I do my PhD?
Yes.
So I completed my M.Pharm. I joined as an assistant professor in one of the college in Bangalore, and I planned my PhD during that time.
Mm.
Okay, so I'm not that great in clinical pharmacy because I completed my B.Pharm, then got into M.Pharm, then I started learning about it. But meanwhile, I went for an internship in Bombay for focusing on evidence synthesis and pharmacoeconomics. So that time I realized that where should I focus? So I
Mm.
realized that I should focus on pharmacoeconomics and evidence synthesis part. Then I took a 1 year, and that 1 year gap, I built my CV. I
Right.
connected with as much as international organization I could. I came out with multiple publication that definitely would help me in PhD. So when I applied for my PhD in Manipal, I was damn sure that I'll get through. There is no
Mm.
doubt in that because I build my CV in a way that nobody can say no. Okay,
Mm.
still there are criteria. I had to clear their exam. I had to attend the interview. That one part, but I was very sure that I can do my PhD with Manipal
Mm.
eligibility. So that 1 year gap helped me to plan many things. During that time, I became myself financially stable that I can take my next
Right.
5 year
Right.
PhD. So that was the best part of taking a gap there.
Mm.
So again I said, but I have a good student who was doing M.Pharm in JSS Mysore, but his professor was so good, and during
Right,
their
right.
master's degree only they did some projects, and he got connected with an international university. So
Hmm.
immediately after M.Pharm, they offered him PhD. He just
Right.
grabbed it. So again, I have one of another student who worked in US as a PhD student, but he worked about 1 to 2 years in Eli Lilly, and from there he got to know many new skills, and through that skill he was able to join for his PhD. So 99 percentage, take a break, understand our strength and weakness, because okay, if you jump into an area where that is your weak point, you cannot sustain in that PhD, because you may complete your PhD, but during that time
Yeah.
whole your mental, physical,
Hmm.
all health related quality of life will be gone. So it's very important to understand that point.
Yes.
So
Yes.
99 percentage, uh, take a break or understand the real world scenario. What you seen in the first year of PharmD may not be same while you complete your sixth year of PharmD, because world is changing, the things are changing. What you planning this year may not be same next year. So you will have to change your plan of PhD accordingly. So take a break, understand the situation, then get into the PhD. Most
Yep.
preference, but still, if you get a very good opportunity that will make you very stable during your PhD, go
Hmm.
for it. So
Hmm.
that is my opinion regarding.
Right. Wow. I mean, your story is incredibly inspiring, I must say, because my career journey was the just opposite because PhD was not planned for me. I just went and enrolled because my mentors motivated me to do. Once I enrolled, I was completely confused whether I should proceed with it or not. So I cleared the exam. I enrolled. I registered. I didn't pay my PhD fees, but I registered and I just kept it like that. And for the next 1 year, so technically the first year of my PhD, I was still figuring out whether I should do or not.
Yes,
So I was just doing like the groundwork of my PhD. And I think only after almost completing like the first year of my PhD is when I was confident, okay, this is the right path for me. And I should. So that is why I feel that I was quite premature when I enrolled for PhD, which is why I keep saying to others that, maybe wait for two years or so before you go in for a PhD, because I struggled in that first 1 year. I was confused. I was doubtful whether PhD is a long term commitment. Is it that what I want to do? I didn't know where I want to do. So a lot of questions came in after I enrolled for my PhD. So because I went through that challenge, which is why I
yes.
keep saying that it's better to wait. Right.
And
So I
one more point, maybe I need to add up there. PhD is not spoon feeding.
yes,
PhD
absolutely,
is
very
out
very
of your
important
syllabus.
point.
It's out of your syllabus. Okay, let it. You take PharmD, you take M.Pharm, anything. You had a syllabus. What you should do each
Hmm.
time. But if you see the PhD, your syllabus will be depends on your topic what you are deciding.
Yeah.
Okay,
Yeah.
I decided a topic in something. Okay, I want to work in acute respiratory distress syndrome. That was my PhD. So I need to learn all about acute respiratory distress syndrome. I need to go back to all my whatever I learned last few years. Then I need to dig into that. Not only that, you need to have a clinical experience. Okay, if you are working something related to your clinical, so you should go with the doctors. You should work with them. You should
Yes.
be part
Yes.
of their team. You should be working in ICU. Okay, as you know, you was working as an antimicrobial stewardship pharmacist in Amrita along with your PhD. Okay,
Hmm.
similar way I was working in Kasturba Hospital as a clinical pharmacist in my
Hmm.
ICU. So you should be balancing both, because
Yeah.
you have to work as a clinical oriented person as well as a research oriented
Hmm.
person. Obviously, it will be maybe around 70 30 percentage. 70
Hmm.
percentage you will be focusing on your research, but still another 30 percentage you have to commit there. You can
Yes.
simply run away from that work also. And there is no spoon feeding. Okay, you can't ask tomorrow going to a professor, and you can't ask what is the review article. He may ask you to drop your PhD. So that is
Yeah.
your duty to
Yes.
go back and check. And you can't ask what is mean by a open access journal. Or it's all it's really you should understand. Like I should I used to say that when you go to your professor, you should be thinking in a way that what is going to ask after I present this. So then
Hmm.
only you can answer.
Be
If they
prepared.
don't want to know what you have done, They want to know what you're going to do next few
Yes,
days. Or
yes,
so,
yes.
so it's all about it's not spoon feeding. Not about a spoon feed. Not even
The self-driven
you have
process.
to. Yeah, it's a process you have to learn. But obviously, all things will be getting rewarded after you're
Hmm.
completing that.
Yeah,
Yeah,
yeah, definitely. We're
that
not
might.
trying to scare you about doing a PhD, but we are just talking
Obvious.
about the reality because we
But
have done it.
that,
Yeah,
yes.
yeah,
And
and
that
because
will be same experience for all of them who did a PhD in a
yes,
it will be
yes.
the same experience.
Yeah. Yeah. And I think it's a very, very much self-driven process. So unless and until you take an initiative to, push yourself and do the next step, nobody is going to come and give you that
Mhm.
push. So whether it's your guides or your co-guides or whoever it is, they will just answer your questions. So unless and until you go and ask them the questions and you go and, talk to them about your progress and your plans, they may not come behind you to just okay what is happening, why are you not doing this, nobody's going to ask you that. So if you want to delay, you can delay for years. PhD can go on
Yeah,
for
that's
years. If you want to finish it off earlier, that is on you. So
and maybe I can say one more point. It's not in point of a student. I'm telling in a point of a professor who guide
mm-hmm,
the PhD.
mm-hmm,
He is taking a PhD. Okay, I say myself. Okay, I'm a professor in one of the universities. Suppose
mm-hmm,
I'm taking a PhD out of my interest
hmm,
because I want to guide someone
hmm.
who can bring a change in the practice or who can
Right.
bring something new.
Yes,
So
yes.
that's why okay, many people will ask why I'm not getting through that PhD process. Because you are not getting through that PhD process because you didn't reach to that level where a professor can experience a change from you.
Hmm,
So we should reach into that level where the professor should think that I can do something innovative. I can do some change in what is already going on. So then only they will be grabbing you. So okay, when they grab you to that position, he is expecting you to make a change, not
yes,
he is going to change. He is
yes.
changing. He don't need you. He can
Hmm,
use any PharmD students or he can use his postgraduate student
hmm,
to make that change. So he is
hmm.
expecting that change from you. Only he will be facilitating it. So
Yes.
whenever any new PhD comes under me, okay, when I was doing my PhD in Manipal, obviously I had many students
Hmm,
who
hmm.
newly joined for PhD under me. So the first orientation will be from me, obviously.
Okay.
So when I start with that orientation, I used to say them that like the guide will be facilitator. Okay, if he is saying that we are going to meet on 23rd, it is your responsibility to make sure that he is available on 23rd during that time. Okay,
Yes.
once he commit 1 month back, may not be same agenda for him
Yes,
to be.
yes,
There will
yes.
be other priorities for him. So it is better you take a follow up on 21st and ask, will you be available on the
Hmm.
same time? If he's not
Absolutely.
available, you have to find an alternate.
Reschedule.
Then you can't ask him. You can't ask him why you given word to me that it's not our daily
That's
life.
not how it
We got
works.
yeah. So you have to accept the reality and go with that. So that's very important part.
Right,
And
right.
think that the guide will be always facilitator. And
Yes.
if that guide is super busy, I mean someone who is in the top position, you can't even meet him for many months. So think in that way.
Hmm.
So that is the one thing I had to add there.
Yeah. Yeah. And I think now we can just go into the actual nitty-gritties of doing a
Yes.
PhD. So I think basically for me, when you're deciding to do a PhD, there should be four major questions that you ask yourself. First is definitely whether you want to do a PhD or not. That's your basic question. I'm not talking about that, but I think the university, your guide, your topic, funding options. These four questions are for me the very, very basic stuff, like whether you want to do your PhD within India, outside India, where is it that like in what specialization, what area, clinical area is that you want to do a PhD in. And for me, having a good guide is very important because guide or a co-guide. So in many cases, it's usually the co-guide who is more available to answer your like immediate queries, and guide is more like a high-level person. But you should have someone in that team to just be just there for you to answer your questions. So it's not that you can go to them every now and then asking questions, but whenever you feel stuck or you need that guidance and motivation, it's always good if you have a person whom you can easily reach out to, which the guide may not be there always. So always better to have a good co-guide also who has a good subject expertise as well. So these are some of my very, very important questions that one needs to ask. And we have got lots of questions from the participants also in these areas. So I think we can start with selecting the university as the first area to discuss. So, for me, if you ask how to select a university, I would actually say before selecting the university, it's good to understand in which area you want to do your PhD and make sure that the university that you select has the right facilities and the expertise within the university to sort of facilitate your research work. So that would be my very basic criteria. And definitely, then the question comes: should you do it in India? Should you do it in abroad? So I think Rashid, probably you are the right person to answer that because currently you are working in US, but you have been trained from India, so you have seen both the worlds. So what do you think? Like choosing an institution or the university?
Okay. Yeah, I'll come back to the same point what you mentioned. It's all about your guide, not
Mm.
about your institution. Okay, institution make sense. I come to that point also. Okay. So choose a good guide, and you see the team whom he is assigning to. That is also very important. And don't think that you have to follow exactly uh, what the instruction is. In the sense, you can't deny also the instruction. But okay, the professor is okay. He joined under a good guide, and the guide is saying that I'm going to keep this person as a co-guide. Okay, but someone who is
Yes.
better than him,
Mm.
always there is a room for your suggestion.
Yes.
PhD is
Yes.
that's the best part. It is not that or it's
It's
not
being
only
enforced on
one way,
you.
one, yeah, forced on you. There is a room for you to suggest. Okay, you say to your professor that, sir, I found someone. I can't say better than him, but there is
More
someone who
approachable,
can
more comfortable.
help more in our project what we
Hmm.
are planning. So why can't we think of him?
Hmm.
So obviously he will be interested because PhD is all about collaboration. PhD is
Yes.
all about networking, and PhD is all about working together. It's not none of the PhD can be done alone. You need
Absolutely.
someone's hand there. So it's a societal commitment. So you need multiple people. You need multiple stakeholders. So, okay, you say that professor, sir, I found someone else who is having more work experience in that field. So why
Hmm.
can't we think of him? So that your supervisor will be connecting to him to help him there. So
Hmm.
you should have a sense when you design your like you mentioned one term that your subject expert. I don't know how many people might be aware of that. Subject expert means PhD is not only PhD student and guide. No,
Hmm.
PhD is about PhD student and guide. It's about PhD student and co-guide. It's about PhD
Hmm.
students and subject expert, because you will have any university, you will have a PhD committee that
Hmm.
involves your guide, co-guide, and other three to four or
Yes.
maybe four to
Members.
five people members who will be always watching your PhD, who will be always
Hmm.
monitoring your PhD. They're called subject experts. And this can be from any field that is related to your project work, who can significantly contribute to your project work. So, okay, when I was working in my PhD, I was working on pharmacoeconomics of corticosteroids in acute respiratory distress syndrome. Okay, and part of that, I had some biochemical analysis as well. So, I had my supervisor from pharmacy practice, co-supervisor from pharmacy practice, and I had another co-guide from critical care medicine. That was a
Right.
doctor, and I had another co-guide from internal medicine because I was involved with ARDS, who's
Hmm.
coming to the
Yes.
general
Yes.
medicine also.
Yes.
So I had a doctor from general medicine. I had a subject expert from the biochemistry, medical biochemistry, and I had another subject expert from our pharmaceutical biochemical analysis. So I
Hmm.
had these many subject experts into the team.
Hmm.
So the point is that they will be from wide varieties of area. And why? Because always your guide or co-guide is not superior in any everything. He
Yes.
have his own area where he is expertise. So
Hmm.
when you are deviating from that area, he will assign someone who can help you with that. Maybe you work with oncology, your professor will not be clinically that strong in oncology. So he will align your, he will tag you with a oncology doctor who can give significantly contribute that. So he maybe he already have some connection with those professors who is working in that area. So he will try to bring him into the team. But still, if you have anyone else in suggestion, there is always a room for that. So that is about bringing the team. Next thing, institution always valid to check whether you have that facility over there. Like
Yes.
I said, okay, so I'm going to do a biochemical analysis. Okay, I want to do some ELISA test. So I should choose that institution which is having an ELISA setup. Otherwise, my PhD will
Yes.
not
Yes.
work
Yes.
there. So recently, I had a student who approached me to know about PhD more. I don't want to disclose the name or university. So they discussed with me about 1 hour about all their project. Then I asked them, okay, they wanted to do something on pharmacokinetics or something on related to that of some antibiotics. So then I asked them, do you have a facility where you can do a TDM? That was my first question. Second thing, okay, you have a TDM setup, but still, are they able to run the TDM for you? Because to run a TDM, they need that big setup where they
Yes.
have multiple machineries.
Mm.
That machineries may not be intended for research purpose. That is very important. Having a hospital is not enough. Having a laboratory is not enough. They should have a facility where researcher can enter into that lab and work
Absolutely.
there. Otherwise, they are not going to allow you to mix your research sample with
Mm.
the patient sample because there are so much of cross contamination issues
Yes.
and they
Yes.
don't want an unauthorized person to enter into their lab. So
Absolutely.
that is where your institution will comes to the picture. Otherwise, as you mentioned, guide is the first priority and their experience and their more than their experience, they will have hundreds of years of experience, but was it matching with your research topic?
Mm.
What's it? Is it in your area where you are thinking of? That is very important. Okay, now you set up your guide and all your team is ready. But next question is that, okay, do I have that facility to run my research there? Okay, when I was like I said one example, okay, we are thinking of pharmacokinetics, whether do you have a lab setup where you can run your pharmacokinetic, because sometimes your patient may come in the midnight or
Mm.
maybe coming in the evening, late evening. Okay, you have to take multiple samples from him. Okay, you are collecting your sample in 0 hour, then you are collecting after 2 hours, 4 hours, 8 hours, 16 hours. By the time the day will be in the evening, so you have to
Right.
collect that sample, then you need to store that sample. You should make sure that the lab is open for you in the evening hours, or
Mm.
else you need to find an alternative facility where you can store your sample. Okay, you might be doing your analysis tomorrow, but you should have a
Yeah.
facility
Yeah.
to
Yes.
store your sample. So institution comes to that picture when you think of one aspect is whether you have that facility to run your project. Okay, next institution is important when you are applying for a funding. Okay,
Mm.
believe me. Okay, when I was applying for my DST, I had 5 criteria. First criteria, whether the student is eligible. Yeah,
Mm.
student is eligible because he got the eligibility to get through the DST Inspire. Next one is the guide is eligible. Yes, guide is having good number of years of experience. I can get through that process. Third one is your project is eligible. Yes, your project is very good. It is innovative. You can get through. Next thing is that whether do you have your university which is having good reputation can get through that funding process. Okay, because any funding process in India or abroad you apply, they will have an eligibility of the institution.
Mm.
Sometimes they will say that the institution should have this much ranking, or the
Mm.
institution should have this many years of research experience in that
Right.
particular domain.
Right.
So that is where next your institution makes important for you to do a PhD. Okay. Obviously, when I was thinking of my PhD, Manipal was my first priority. Second priority was Naipur, but Naipur is somewhere is north, so I can't come back to my home whenever I want. So I prefer Manipal. That is one reason. But second reason, Manipal, I knew that there are people who got DST Inspire Fellowship in Manipal.
Mm.
So Manipal University is there in their list of getting that funding to me. So that was my second prior chosen to choose that institution. Then obviously whatever facilities I need, I could confirm that it is available in my university which I'm going to choose. So your guide is then your facility is available. Next thing is your project. When you think of your project, as you mentioned, come back to the point which we were discussing first, your experience matters there. Okay, well, just your PharmD or M.Pharm will not give you the essence of what the real world is needed. Okay, you work as an assistant professor or you work as a clinical pharmacist for 1 year. That is where you are going to see the actual problem in the real world. What patient need, what stakeholders need, what you should do through your PhD, which will be helpful to the society. So that is where you are going to pick up your project. That is where your project will have a sense. Okay, you can do PhD in any topic, doesn't matter. But if you are thinking that should make a change through your publications, through your conference presentation, through your inclusion of PhD in the uh, your medical domain, then you should choose a topic which can change the world. It will be hectic, I'm sure. It will be hell out of work. You have to break a lot of things. Then you can get through. Next thing, okay, your institution is not having that facility, but whether your institution is having a collaboration
Yep.
where you have that facility, it is not always that that institution will have that facility,
Hmm.
especially in a low resource setting like
Hmm.
India. They will not.
Yes.
Okay, or okay, you work in a university. That university may have an attached hospital, maybe near or somewhere between distance, but they will have that facility. Whether that facility can be utilized for your project, that makes sense. So sometimes they may not have that facility in their host institution, but they will always have a collaboration or a network where they can provide you that facility. So you need to explore. It is not always that okay, I don't have that facility, I should bring through my grant. No, it may not be always possible. So to bring a whole setup of lab through your grant. So that time what you should think of connecting with another institution where you can make a collaboration and get your work. It's always get your work done with
Hmm.
the facility what is available. Because
Yes.
okay, you again think of a new facility where you can do your work, but it will take another 1 or 2 years. It is not that easy to get an instrument. It is not that easy to get a facility to your institution because they have to you have it is a process like your guide, your department, your institution, your university, then to the funding. So it will take a lot of time to bring that facility to your institute. But instead, okay, I have a collaboration where I can bring that. I means I was working when I was working, I brought many collaborations during my PhD. So it was useful for you to have a long-term relationship, and that will give you the next set of life where you want to work. So
Hmm.
that will take you to the next part of your journey. So all these things we should be considered while you think of your PhD. Okay, next you think of abroad PhD. Again, it depends on the need. Okay, so to the area which you are focusing, it's
Exactly.
already established, or you have good number of experts in your own hands, or you have good number of facility in your own hand, or you have to work for your society or your community which is near to you, then why you should go abroad? So
Absolutely.
that is the question you should think first. You think of abroad. Okay. Okay. Then you ask me why you went abroad. Okay. I went abroad. I came abroad because I was working in an area called pharmacoeconomics and outcome research. And if you get into that area, it is still in a kind of infancy level in India
Right.
where I don't get more expertise in that area. So obviously, I need to migrate to get that expertise
Hmm.
here. So that is what even I didn't go for my PhD. I came for my postdoc after PhD.
Yep.
So my aim was that I should work in India. I should learn in India. I should settle in India. But unfortunately, I had to change the path because I need to get
Yep.
more expertise in that area. So okay, now you come back to the question whether in India or abroad. You have all the things in your hand in India, go for the PhD in India. There is no doubt in that. But if you get a good opportunity from abroad, which you think that obviously abroad PhD is one step
More
ahead than
advanced.
Indian PhD because they have all the facility what you need, they have all the expertise what you need. but believe me, you will have to I don't say that you will have to work more than what you work in PhD, but you will have to do more advanced things here
Hmm.
than what you do in PhD in India. So that is what make the difference between an Indian PhD and a foreign PhD. But if you have all that facility in India and you are able to do that same facility in India, you don't have to migrate it, because when you migrate, you have to take care of many things. It's not that easy to migrate. First thing, you have to leave all your family there and come to here, and it may not be easy to fly back from US back
Yes.
to your country so fast. That is one thing. Second thing, you have to do a lot of paperwork. It will be done, no doubt in that, but meanwhile you have to manage other commitment. Okay, I was doing my postdoc paperwork during my final part of my PhD. So you know how it's struggling to write a PhD
Yes.
thesis. Meanwhile, I was working on my visa, US visa, and other things. So you have to manage both sides properly. So then that struggle, if you are ready to take, no problem, you can come out of your PhD abroad. But still, you should fulfill that, whether I will get something additional what I don't get in India. So that is where your thinking should be going outside India. It's
Hmm.
not not only financial. Okay, you can have financially stable. I'm not saying that you cannot be financially stable, but believe me, the same you can get financially stable in India doing a PhD there. There is no doubt in that. If I used to say my students when they ask me, sir, the first question when they join for a course, they will ask me, sir, what job I will get and what salary I
Yeah.
will get. So that will be the first question when they join for a even for a certificate course, they ask
Yeah.
that question to me. So then I say that first you learn, then you
Exactly.
earn. Once you learn, then you don't have to worry about earnings. It will automatically comes, and it
Absolutely.
will come. I say it will come. It's not a philosophy. It's not a. I don't. Maybe it's a philosophy. I don't know. But when you have adequate skill and learning, believe me, earnings will automatically comes. Then it's your duty how to manage it. Okay, so that is a different story. So abroad PhD, you think if you get something additional than what you don't get in India, otherwise you are ready to take a risk of thinking of many financial. In the initial stage, it will be financial hardship. How much ever money you have, still there is a financial hardship in the initial stage. But over the period, you can make up that maybe in 6 months or 7 months, no doubt in that. But still, you have to come out of that stage. Okay, then you come all together from a different setting to US. Okay, still I'm learning US. Yesterday, my friend asked me, "How is your things are going? Is everything okay?" So I said him that uh, I'm 100% still doing what I was doing in India, but I'm doing it in a US perspective. That is the difference
Hmm.
here. So what you studied long years in India may not be same here.
Yep.
You need to change everything. Okay, even you are talking, you need to change your accent, you need to change your I'm still learning English now because I need to talk with many people. So that all things will come to the picture, but then still you think whether it is beneficial for you to relocate.
Absolutely.
If it is beneficial for you to relocate, no doubt in that, go for it.
Hmm.
But still you are available now. You see, India is having a lot of opportunity, they have a lot of facility, everything. Now Indian grant associations also funding like anything now. So you have every facilities. If it is available, do it in India, because you can serve your community better. If not, you want more advanced learning, advanced things, come out of go for a foreign degree. Otherwise, for me, both are same. As per my experience of doing PhD in India,
Right.
I think I I found I got a good profile, all similar profile who did a PhD in abroad. So
Hmm.
I don't see much.
Right.
If
Right.
that's it, yeah.
Yeah.
Maybe I can tell more conflicts
No, no,
today,
I
but
think
this is
I
the
think it's
best part.
important, like the points that you mentioned are very crucial because many people are confused in that very question, like should I do a PhD within India or should I go abroad? So to just summarize what you were just saying, I think the most important thing is in what topic, in what area do you want to do your PhD? Do you have a university within India that is fulfilling all those things that you want to do? But if you rightly, like you rightly mentioned, but you think that, say, for example, pharmacoeconomics is not so much advanced in India, but you want to learn more about it. See, you have to do what is best for your career. And there is nothing wrong in being selfish there. So if you feel that, it's maybe in the US or in the UK or in Australia that they have the right expertise for me, well and good. Please migrate. But again, all these factors comes to play, whether it's financial, whether it's personal commitments, whether it is professional commitments, everything comes to play there. So make sure that you take an informed decision and not just jump at the opportunity of going abroad. It might look a lot rosy, and I mean, the grass is always greener on the other side. So from an Indian perspective, when we look, it's a high income country, definitely, whether it's US, UK, Australia, whichever it is. So the quality of life, everything will definitely be better there compared to an Indian scenario. But that shouldn't be your, I would say that shouldn't be your first criteria. Your research
Yes,
should be your first criteria, and be very sure that, because there are lots of universities abroad who may not again cater to your needs. So just because you want to go abroad, you choose a university, and then you land there, and once you study your PhD again, you would find that you don't have the right expertise and things like that there, and then again you're struggling, but then you're struggling in a foreign country. So that
yes,
again has a lot of additional burden also to it. So always take a very informed decision, and I don't think we can really compare Indian universities and international universities, because both are at a very different stage, especially when it comes to clinical pharmacy or basically pharmacy. There are areas developing still in India. So, which is why I don't think we are in a position to compare the universities per se, and to say, okay, abroad universities are better than Indian universities or vice versa. But I think it should be very much subjective. And it should be catering to your needs and to your subject, wherever you want to do it. And the other thing that I really want to highlight here is, I think many of the students who pass out, they expect things to be served to them in a silver plate. They expect, they keep complaining. I have heard lots and lots of complaints saying that, PhD is nowhere in India. It's still, there are no opportunities. What is it that I can do staying in India? I have been asked many times by students asking me, like, why are you staying in India for so long? You passed out in 2016. What are you still doing in India? But if you ask me that question, I would say that, you have to create opportunities for yourself. Definitely, US, UK, these countries are far advanced, because just looking at clinical pharmacy itself, they have clinical pharmacy way before we had. But they also had these struggles in the beginning.
yes,
They evolved over the years, and they improved their system. And now, if you look, they would be in an advanced state than us. But again, they had their struggles. So right now, people keep saying, okay, what is it that we can do staying in India? There's no opportunity here. Create that opportunity for
yes,
yourself. And like Rashid was rightly mentioning, make sure that your CV is strong enough that nobody can reject you, whether it's in terms of publications, your academic records, whatever it is. Make sure that you are having a strong CV. That is what you can do for yourself. That is something in your hands, majority in a majority case. And make sure that you put in that effort to build your CV through your college life, and once you pass out as well, so that when you apply, you don't get a lot of rejections. And having, investing in your career, especially in that initial phase where you don't look at, I would say the first 2 years are very formative. So look at quality more than quantity. So rather than focusing on your salary and those things, I would personally say that look at opportunities, look at exposure, look at whether you're getting a good mentorship. So those aspects will take you a long way. Definitely, salary matters, no doubt about it. But I'm just saying, in the initial years, make sure that you're not focusing too much on the salary, but rather focusing on the quality of your work and building skills and improving your skills, so that later you can demand for a higher salary.
yes,
So
exactly.
yeah, I think you need to take that effort, and nothing is going to come to you on a silver plate. There might be few lucky ones who get it like that, but you have to take
But
that
still, they
effort.
have their own struggle
Of
there.
course, of
It's
course.
not that easy. And you
Yes.
said about, I just want to add one point which you are talking on as a follow-up. When you talk about publication, maybe we may not discuss that part here much. Like you see, you need publication, but it should not be a bogus publication. That is
Yes,
very important,
absolutely.
especially from your background. I know that when we came through that situation where your professors or where your supervisors may not be good, uh, or they might have not communicated you properly in a way that which journal you should have published your
Hmm.
paper. So it's you don't go for all these fallacy journals, don't go for all these
Hmm.
bogus journals. So you either I'm saying openly, go for either PubMed uh, indexed journals, or okay, if your university's need is a Scopus indexed journal, go for Scopus indexed journal, but plan for Q1 or Q2, top two
Yes, yes.
quarter. Don't go below that, because when okay, not only abroad, in India also, when you apply for your PhD, your academics matters, but more than your academics, your research profile matters. So when you mentioned about build your CV and make your publication, don't get confused getting
Hmm.
your
Yep.
publication into any bogus journals. Make your publication into the good quality journals. Obviously, it take time. Believe me, it will take years together. Okay, even you get rejection after 1 year or 1.5 year,
Yes.
it's a part of the game. You will get depressed during your first. I think we have discussed all these things during
Yes.
our publish or
Yes. You
perish.
can you
There was
can please
another,
go and
you
see
can
that
go back
webinar.
and check that webinar. I think it
Yeah.
was very useful. You can go back and check this webinar, because we don't want to discuss much on that, but I want to emphasize that especially from Indian universities, those who complete your PharmD or M.Pharm, don't get your publication for publication namesake. Get it done for your life, because that matters. Your postgraduate or PharmD publication matters a lot in your life. Wherever you go, you become a professor, still you will get a question that did you publish your postgraduate thesis in a good
Hmm.
journal?
Hmm.
Because that was your route to get all these things. If your postgraduate publication, or you are starting with a bogus journal, to reach to the high quality journal, you have to put a lot of effort, because it's very, but it's, if you are starting with a high quality journal in the start itself, then everything will be easier. I think we
Yes.
discussed all this point during
Yes.
our
Yes.
that
Webinar.
webinar. You can go back to publisher perish webinar, because we detailed
Hmm.
information is available there. But here I just want to make one point
Yes.
that
Yes.
especially when you think of PhD, you will be thinking of publication, but don't make it in any bogus journal. Go
Hmm.
for very good journals, reputed journals. That even one reputed international paper is more than better than 10 other bogus journals.
Absolutely.
So
Absolutely.
go for a good quality. One publication is good enough to show your talent. Recently, I had one student from one of the prestigious university, and he got two publication during his master's degree. Because of that, he got called from AIMS, New
Hmm.
Delhi, for a research position, because of two publication he got during his masters, and both of that was the topmost journal in the drug safety. He did some disproportionality analysis there. So what I point is that your publication matters a lot, but meanwhile your publication should be in a good quality journal, because though they want aims, they want to take someone who is having more experience in medical field, but they can't deny his profile, they can't deny his CV, and they kept him in the waiting list because of his two publications. So
Hmm.
publication matters a lot, but it should be a good quality publication. So
Yes.
that
Yes.
all matters, important thing.
Yes.
But
Yes.
still, when you come to the again question, go if it is go back to between India and US, or abroad or foreigner, again all these things you have to think of, and there
Hmm.
will be a lot of struggle. Believe me, your international or foreign professors will not take you easily. You
Hmm.
may have to write hundreds of mails. Out of that, maybe one or two mail you will get response. You don't think of a PhD student who write, or looking for a PhD writing an email from India. Even
Hmm.
a professor from India, or not only India, even a professor writing an email, they will not have time to check that
Yes.
emails.
Yes.
Okay, it's not their fault. They get, my professor get, I know that my professor get within half hours of our discussion,
Hmm.
then he opened his mails. There will be like 35 to 50 emails, and
Yeah.
he have another meeting next minute. When he will
Yeah.
check this 40,
Yes.
okay, he
Yes.
will check. If he is committed, he will check. No doubt in that. They will check. But your profile should be that strong to get through his mind.
And it
Okay,
is very
he
competitive also.
it's very competitive, and your profile should be so strong. And not only your profile, what you write in your email matters a lot. You
Mm.
have a big CV, you have a lot of things in your hand, but if you are not able to communicate it properly through
That's your
your
first
email
impression.
or your cover letter, no doubt you don't get through it. And don't believe in those things. You always prefer emails. Always
Mm.
prefer email, because no professors, no university will prefer any other method of
Yeah.
communicating, like
Yep.
your Twitter, like your WhatsApp,
Mm.
or your
Mm.
uh,
Mm.
LinkedIn.
Yep.
No, they might share you some information. There is this opportunity, but it should not be you are okay. One someone send you a message in LinkedIn saying that this PhD is having in that university, then you are supposed to go to that link and check its eligibility and everything. You can't reply him asking that, am I eligible for that? He may not
Mm.
be knowing that you are eligible for that. It is
Mm.
your duty, your responsibility to go back and check, are you eligible for that? And you
Yes.
can't ask him how much salary they give. Everything will
Mm.
be mentioned
Mm.
properly there.
Mm.
Any posture you get, any PhD opportunity, not only PhD, any opportunity, jobs, anything you get, it is your need. It is not their need. So it is
Yes.
your responsibility to go back and check, am I eligible for that? Do I have sufficient skills to that? Do I have sufficient eligibility for that? And you can't reply him asking that what is the salary they give? What
Mm.
is the responsibility I have there? What topic I should do? He don't know. At that point, he never send you back any communication from that point. So don't, it should not be, you should not bother them, you should not burden them. It
Yes.
is your responsibility to go back and check on that. So
Mm.
that happens many times with, it might be our curiosity or to know more
Desperation.
about that we will, but it's not that actual way of. So always prefer
Yes.
emails. If you want more detailed information, write a proper email. And now you have all AI stuff, and
Yeah,
also
yeah,
write
yeah.
properly. You can utilize. Nobody's against the AI, but it
Use
should
it
be
in a
used
sensible manner.
professionally. It's a professionally. That is, nobody's
Yeah.
against AI, and but it should be used professionally. So
Yeah.
that's it. Yeah.
Yeah.
So it makes a lot of your
Mm.
cover letter, your emails, your communication, your first impression. That's very important.
Yes, yes, yes.
I think we
Uh,
have covered almost. Yeah.
yeah. So I think, Rashid, it would be helpful for the participants if you could just simply summarize the process for applying for a PhD
Yeah.
in a US organization. Like,
Okay.
what are
Yeah.
the just the steps?
Yes, exactly. So the first step, as I mentioned, you need to identify. Can I share? I will share my screen. Okay. So
Mm-hmm.
that will be easy. Perfect.
Okay.
So first point, as I mentioned, you should have a list of resources where you can find your PhD options. And this you can do during your master's or PharmD only. During your sixth year of PharmD, or during your, okay, I'm planning my PhD next year. It is not that you go on December 2025 and check what is the opportunity. No,
Mm.
you have to check from today. I myself, or anyone who crossed this path, might have checked maybe 1 year before what should be their PhD, what are the different opportunities, because it will take time. It is not a
Yes.
1 day process. It will take minimum 6 to 7 months. Minimum, I'm saying it's 6 to 7 months, because you need to send an application. They need to review that application. You should have multiple communication back to back. Once you have that communication, they should be getting you like to that position. Then they will send all the formalities. There will be formalities between you and your guide. Then there will be formalities between you and your institution. You need to pass through all the steps. You can't skip any of them, whether it is
Mm.
in India or abroad. You can't skip those process. That process will take time, and for that process you should be ready, maybe few months or 1 year back. Then only you can get through that. Otherwise you have to wait for next opportunity.
Mm.
So that sometimes what will happen, I have seen many students, their everything is ready, but they could not get the visa.
Mm.
What can do? Nothing can be done. You have to wait until you get your visa.
Mm.
So okay, you have to plan accordingly. You should know what you should need. Okay, you got everything, but you can't come out of your institute, your already working environment. They need you to have 3 month notice period or 4 month notice period. So you can't commit to that PhD there. So you need to be planned properly. Then only you can go that. So you plan for next year PhD. If you're planning, plan right now. What is your careers? What is where you can have the resources and all. So since I was looking to the economics thing, I'm just opening multiple opportunities. So first thing, as you also might be knowing, if you are looking for any antimicrobial stewardship program, I am pretty much sure that International Society of Infectious Disease might be
Mm.
the one good resource where you can think of here. Since I was looking to the, so you should have an international organization to check all the career opportunities internationally, because every universities, every professor will be putting an opportunity over there. Okay, I'm looking for someone who know something about pharmacoeconomics, suppose. So obviously I will look to the someone who is having a connection with ISPER, who is already working in part of ISPER. Okay, you are looking someone who is working in infectious disease, so obviously you will be looking someone who is having a connection with the infectious disease organization, because that will make more sense. They will have more interest and more knowledge on that area. Okay, so like this, every organization will have a career path. They will have a resources or they will have a career path. So you can go to that career path. You can explore all the options. So this is for if you are looking for a job related to pharmacoeconomics and outcome research, you can look here everything. They will have 100. Believe me, my postdoc I got from Whisper Career.
Mm.
Then I connected with the professor and all those things happened through
Mm.
multiple ways. So here, okay, I'm looking for a candidate. Okay, HER Career Center. If you click here, they will give you so many options here. See here, they will have director of pharmacy, senior principal. So here, all the PhD related jobs also come. You just click all jobs, or they will have a search options here. So if you just search here, you will get everything.
Right.
So then you can, if you want, I want to be specific to any location, you can keep that. All those things can be possible. Then you can search here. So this is one way of searching. See here, all the things will come here. These all offer PhD. It might be in different names, but they will give you the PhD also.
Mm. Mm.
That is
Mm.
the one thing. Then next thing, if you go back again, you can check here. There is careers at ISPER or resource center. Or sometime what will happen, this is also good option. You upload your resume here. Don't give any personal
Mm.
information. You give upload your resume here. So
Right.
automatically the AI will choose
Notification will come.
which yeah, it will bring you. So
That's
every
nice.
time if you see here my email, if you just search here, they will send you all the ISPER career. So they will send you all the information. See, two health economic jobs. Like this, they will
Mm.
send you everything. See,
Right. Right.
pharmacy
Right.
fellow. So this means I was interested in sorry, postdoc. I kept my uh,
Pop
Dropbox
down.
into
Huh.
postdoc. So they send me only postdoc fellow.
Mm.
So you can do that.
Nice.
You can just
Mm.
get into their newsletter or their subscription where they will send you all this information. So that is one way. I think it is same for almost every
Mm.
international organization. So
Yes.
if you just keep an notification on or turn on your notification, they will send you each. Even I think all of you might be using LinkedIn. LinkedIn will send you this job
Yes.
may fit for you. This opportunity might fit for you. Same way you customize that into the area which you want to work. So if since I was looking into ISPER, I was always keeping this way. So
Mm.
ISPER will send you always notification that job is there for you. So I can look through, I can say check all the eligibility, I can, and the best advantage is that when you sending through ISPER, your professor will get a sense that you are already active in that organization. And
Right.
he is looking someone who is already active in that organization, because his burden will be reduced there.
Mm.
You
Mm.
don't have to go. Okay, obviously you are looking someone who is in infectious disease, and there is someone already have a good terms with the infectious disease organization. Obviously you choose them
Of course.
because they know some basics on infectious disease. So I'm looking someone who is in health economics. Obviously I go through ISPER, because ISPER will have a directory there where they will have the people, and this notification will go only to those people who are connected with ISPER, and I can filter my applications
Mm.
there.
Mm. Mm. Mm.
Okay, I will get only from those people who have some connection with this organization. So they will have some interest in this area which I am looking for. So this is one way of getting the uh, applications or
Right.
looking for job opportunities. Then obviously, as I mentioned, LinkedIn. I just searched it today morning, PhD in United States. You see how many opportunities,
Hmm.
2,100 opportunities. So you need to filter again. You have a lot of things to filter here. You see,
Yes.
you can filter very recent or any time. I want only past month. You can filter past month.
Hmm.
It will show you again 1,400 results. Then okay, I need a internship level or entry level, or I need something executive level. You can think of that also, no problem. Then okay, you are very you are looking for something about good salary, but make sure when you expect a salary, you should have that skill and
Yes.
adequate
Yes. Yes.
things with you. Okay, then you are looking something very interesting. Okay, you are looking only very specific companies. You can check for that. So you can do that. Okay, then I can just search even PhD in infectious disease. That also I can do. No
Hmm.
problem. So this is a very good resource. You can see you're getting.
Hmm. Right. Right.
See,
Right.
it may not be exactly a PhD. This is something like a investigator. So you will be absorbed as an RA, means research associate. Then you will be
Hmm.
converted to
Hmm. Hmm.
PhD. So all
Hmm.
those options. But you'll see, still you see, when I put PhD in infectious, this is still 800 opportunities in the United
Hmm.
States. You can
Hmm.
change this location. I can change India. I can change, even in United States again. You can. I want only in New York. I can check the. See, all those opportunities are there.
Right.
So
Right. Right.
LinkedIn is a good resource, and the best thing about LinkedIn, while you make your profile or while you adjust your profile, you can subscribe it. So LinkedIn will send you the
Hmm.
notification.
Hmm.
I was getting alerts, but then I unsubscribed because there is no point in filling my inbox.
Hmm.
So you can always do this. This is very important. And best thing is that sometimes they will say that about, see, full complete information is here. So
Hmm.
there is no thing. So then they say, see, this is something director post. So they will ask for the some experience. So you can check for even PhD or anything here. So you can just check the PhD in economics also. See, so I used to search sometime there. See, one result, but that is in the New York area. You can have see
Hmm.
field contractor. So
Right.
you
Right.
can
Right.
have it. So it's always important. So they will give you terminal which field contractor with a terminal PhD degree. So they will go with it. Or PharmD is also eligible for that.
Hmm. Hmm.
Then
Hmm.
later you can convert that into PhD. And
Hmm.
sometimes what will happen now, that is very important. You should understand. They don't directly write it is a PhD.
Hmm.
They will write it indirectly. So in the sense, because if they directly write PhD, they will have to keep a slab payment for that, or they will
Okay.
have some additional requirement to be kept for that. So they don't keep it. They will
Hmm.
keep some other name, but it will be a PhD option. So it is uh, your understanding, or you need to read further more on that, or you need to communicate with that specific university or specific professor to know whether it is a PhD opportunity
Right.
or not.
Right. Right. Right.
And believe me, in India, you have that specific qualification. You should have this degree to do PhD in this degree.
Hmm.
Here, it is not like that.
Okay.
Even recently, my professor was looking for a postdoc fellow who have an MS.
Hmm.
They don't care. As far as you have the skill, as far as you have the knowledge, they
Makes
don't
sense.
care. They will take you. Even here, the PharmD or MD is eligible to take the fellowship, means
Hmm.
postdoc fellow. They don't need PhD in the middle
Okay.
to do a
Okay.
postdoc.
Okay.
So there are so many ways also. So you can get through that, no
Hmm.
problem. But you should have the adequate skills and knowledge for that. So this is
Right.
the second way. Like this, you have many other websites. Indeed is there. You have a lot of DAD is there. DAD for German universities, DAAD. DAD is for German universities. And there are a lot of other websites. But again, don't get into the scam,
Hmm.
because that is very important. Many times we will be fooled, we will be getting into the
Yes.
scam.
Yes.
Don't pay any money blindly. None of the university will ask you the payment until you reach into that stage of paying, making a
Selection.
payment.
Yeah.
In the initial stage, they don't ask. Even Indian universities will not ask you the payment until you reach into your completing your
Hmm.
application. I think so. So only make the payment through the official websites or official make payment ways. Don't make any payment into any kind of scam or any kind of website, because it's very important. They will make you exactly same look like that university website,
Right.
but it will be scam. So you should be
Right.
very careful about that. So then this is the second way. One I said through the professional organizations. Second way through the LinkedIn or any other related, even Twitter. I think I'm
Yes,
not
yes.
that good in Twitter. So
Yeah.
maybe Twitter also might be giving this kind of opportunities. So you can check. Next thing, as I mentioned, you need to go to the university website. Then once you go to the university website, you can see that, okay, I just opened the University of Utah, School of University of Utah. Then you can see the resources or degree product programs and contacts. So if you just click on degree program, sometimes it will be degree programs, sometimes it will be like, opportunities, sometimes it will be career, sometimes it will be learning something different names. So you should be good enough to track what name they use. So, or else sometime it will be resources, but resources I think for job, but degree programs will be here because it's considered as a degree. In India, it is considered PhD is something very high things, but here it's considered as a degree. Okay,
Right.
so you go to here. I just search PhD in medicine. Okay, you can search. See here, you can see. Are you looking for a master's or certificate course or doctorate or any degree? You can filter here. I just put degree. Then I just search medicine. Okay, if I search, just change here, pharmacy, nursing, whatever you are looking for. So I just put pharmacy. So then I submit it. They will send you all the options in pharmacy, medicinal
Right,
chemistry,
right, right.
molecular pharmaceutic, pharmacology, and
Mm-hmm.
toxicology. Even they give the contact address also of the professor or the one who is going to take.
Right,
But
right.
it doesn't mean that you can just send some silly doubts. They don't answer for that.
Mm-hmm.
So they don't do, see, pharmacotherapy and outcome research. This is my own one, but I'm not sure when they put this. You have to check. This is my professor. Okay. So I don't know when they put that, but right now he is not taking any PhD, just for your information. Okay. So I just asked last time, are you taking any PhD? He said no, but this might be sometime before. So you
Yeah,
need to
yeah.
go in and you need to check when they kept all this information. So you need to contact the admission team. So they will ask you to do all those things.
Yeah, this was
So
15th of December deadline.
yeah, so you need to check all those things. Once you got that picture, then you can go
Mm.
ahead.
Yep.
Okay. So this is another way you go to the
College
university
websites.
website and get that through then. Another way, you should always know who is the top people in your field.
Mm.
Okay. When I said you that I came to do postdoc under an expertise, my professor was the one who developed the guideline for pharmacoeconomics, and who was the one who developed the methodology for meta-analysis of economic evaluation. So you should see their profile, or you should know who is. Obviously, you when you look into the ICID, you will be looking to the Payal Patel, Dr. Payal Patel, or you'll be looking like all our faculties who is expert in that top domain. So you should know. Okay, you plan for Indian PhD, you should know who is top in that field in India. Okay, then you should know if you are looking for abroad. Okay, I'm looking for US. I should know who is top in that field in that particular area or geographic location. You can't have someone who is in US and do your PhD in India. It may not be possible always. Okay, so when you check that, you should know who is top in that area and whether your profile is in matching with them. Okay,
Mm.
though it is infectious disease, again there is subdomains. Though
Mm.
it is pharmacoeconomics, again there is subdomain. Though it is any field, there is
Yep.
subdomain. Everyone will not work the whole area. There will be
Mm.
again division what they are focusing. Okay, so you might be more focusing on qualitative interview. So you know who is top in the qualitative interview nationally and internationally. Then approach through them or approach to them. The
Yes.
advantage is that if your profile is very good and he don't have an opportunity, he can refer to someone who is having an opportunity. So he
Mm.
can ease your path of getting to your PhD.
Mm.
May not work always, but sometimes it works.
Mm.
Okay, that is an important thing. Second thing, you get connected with those people who is working under them. All the international universities will have a domain where they will tell the lab.
Mm.
Under this professor, these people are postdocs. Under this professor, these people are PhDs. Under this professor, these people are doing the some kind of research work. So you see anyone who you can contact. So connect to them. There is no nothing wrong. We Indians have that thinking that I myself had. Okay, we think that okay, if I connect to them, will I lose my opportunity? No, if you connect to them, you don't lose your
Yeah,
opportunity.
yeah.
But if you connect to them in an indirect way, or if you connect to them which is not a professional way, then you will lose your opportunity. There is nothing wrong in asking for opportunity because people need, see, what you think, okay, I am picking a random guy, instead somebody is coming to me, whom I'll pick? Obviously, I will pick someone who is coming to me, but they should have the adequate qualities what I'm looking for. That's it. So there is nothing wrong in connecting with the people, but connect in a professional way. So what you do, you check their profile. Okay, everyone will not be working in same area. Somebody, if in under infectious disease, one person is working in qualitative research, another person is working community related work, another person is working public health, another person is working in evidence synthesis, and then you should think whom I should connect. Whether my interest is in evidence synthesis, I should connect someone is in evidence synthesis. Whether my work is infectious disease and community related, I should connect. There is no point in connecting the other person because he don't know anything about that related area. So
Mhm.
you should connect to those people who is in completely syncing with you what you are thinking or what you are looking for.
Right,
Then
right.
connect with them. Casually just write an email. Okay, these people you can write in LinkedIn also, but it should be pleasable to them. You can't write, "Hi, how are you?" They don't respond, and you can't complete what we sometimes people, students or somebody will I'll tell that you just message that person, so they will say that he didn't never responded me. Okay, then I will ask him what you messaged him. He messaged, "Hi, good evening, how are you?" How he will respond? He don't respond. You write nicely that, "Hi sir,
Yes,
I'm so and
yes.
so, and I have this much of experience, this much of things with me. Will your lab is considering any PhD opportunities? If it is there, I'm more than willing to contribute, and please get back to me whenever there is an opportunity." You write a professional message. LinkedIn is not like your TikTok. I used to say sometime to the student, LinkedIn is professional always. So you should
Yes,
write a professional, even your content should be professional. As
yes,
soon as you write to
absolutely.
someone, believe me, they will look into your profile.
Hmm.
They will look into your LinkedIn profile, and your LinkedIn profile is full of Instagram videos or such kind of YouTube videos, then are never going to check for that. So always be careful with your social media contents, because if you are looking for, if, I'm not telling that you have to be completely away from your social media or other related stuff. Do that where it actually means. You do Insta reels in Instagram, not in LinkedIn. You do your those kind of things there, not in the LinkedIn. LinkedIn is only for professional journey, there is no point in simply telling all your life there. No, you write only what is relevant to your professional journey. Okay, you got a certification, you write, no problem. You got something achievement, professional achievement, you write there in LinkedIn, no problem in that. But there is no point. I In the initial days I used to see the difference between get a normal message and LinkedIn message. So they say that I got my driving license in the normal message. But when it comes to LinkedIn, I would like to inform you that I got my driving license from this organization. There's no point in that. So always consider LinkedIn as a professional, and always message to the people professionally, because they don't respond. Even I don't respond. Okay, you are writing me, "Hi, how are you?" That doesn't make any sense to me without you introducing yourself. Who are you and what? There is no point in me check. Okay, I may, if I know you personally, or if there is any other interest. Okay, you are a follower of me for a long time and you are being a good connection with me. Okay, when you message, "Hi, how are you?" I may respond to you, but that doesn't mean that I will take you through my professional journey. There is no
Right.
thinking, there is no thought provoking things like that. So what you should do, write professional messages, they will respond to you. But you should be able to sell yourself. Having only the things with us doesn't make any sense. We should be able to communicate our skills properly. I should be able to convince them, am I fit for their organization? So then this connection, okay, if a fellow who likes you, obviously he will refer to his professor. That will happen. But for that, you should have a professional communication, professional. So that is a one way, or else you can check for any reference. But still, don't rely, don't burden them. Okay, what happens? Okay, one of my senior who is working in some organization. Okay, if I ask him, do you have this opportunity? He may share you some information what is there in that organization, but then you don't bother him, you don't always ask him like how can I get into that. It is everything written there, you, it's your duty to go back. From tomorrow onwards he may block you, so don't do that, such kind of things.
Yeah.
just 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 get some information from them, but meanwhile make sure that you are not bothering them or you are not a burden for them. So these are all
Absolutely.
different ways to get into that
Yeah.
over the, yeah. And you don't think like these guys are taking telling so many things, but we are just telling the real world experiences what we had. But in the initial stage we make mistakes, we will commit mistake, there is
Yeah. We
nothing
have
wrong
gone
in
through that
that.
and we are giving you this
Yeah,
advice.
yeah. So we will make mistakes, we will get rejections, we will, the things will not go the way what you think, but always learn from that and come out of those struggles so that
Yeah.
it will be more easy and get into that.
Yeah.
And I think we have covered almost every
Yes.
part. And
Yes.
there was something specific to questions like I would like to work on
Yeah. I'll
pharmacogenomics
come to
and
that.
what
So,
kind of, okay.
yeah, I'll come to that. But I think
So with
yeah, sorry. So Rashid, I think you have covered everything in very, very detailed manner. Even though we have quite exceeded our podcast time, I think this would
time,
definitely
yes, yes.
be useful for our participants. And I just wanted to add one more point to whatever you said. Make good use of your LinkedIn account and your X account and other professional fields, and always follow the right people, because many a times these funding agencies, universities, they post about all these opportunities on these social media pages. So when you follow these pages and you follow the right people, you will get to know opportunities also easier. So you don't need to then go to either do a Google search or you go to the university website and do the search, because many a times when a call comes out, they all post it, or
Yes,
these professionals in that particular field try to repost that and share it with maximum community. So just follow these people, know who's the right person to follow, and just follow them also on these platforms. Okay, so I think our last area is one question that we got from a
hmm,
participant who is currently a third year PharmD student and aspire to pursue a PhD in pharmacogenomics. So this participant would like to ask few questions. Basically, what are the topics and subjects that they should focus on while doing their PharmD? Whether there are any courses or certifications which would be beneficial for the future, and foreign universities that offer scholarships for PhD programs in pharmacogenomics. So I think we can just quickly answer those and wind up our podcast.
perfect. So as I mentioned, when you asked me about what kind of courses I should do, I may not be able to tell that exactly because I never work with pharmacogenomics, though I
Yes.
given an attempt during my first year of PhD. It took me around 2 days to understand one article. That moment I realized that
This
pharmacogenomics
is
is
not your
not
cup
in
of
my place,
tea.
cup of tea. So I just left pharmacogenomics there itself. Then I said, I just did a simple biochemical analysis. Okay, it was an ELISA based test I did because I don't want to completely avoid that part. And yeah, that story. So my point is that if you ask me specifically on pharmacogenomics, I may not be the right person to answer that question. Instead, if you can post that question to someone who is already working in pharmacogenomics or PhD in pharmacogenomics, he can give more inputs on that. But as a courtesy to our FCPI commitment, maybe I myself or we both, Vrinda also, we will find someone who is working in that area. Maybe we can share the profiles with
Yes.
you. But still, again, I'm saying that don't burden them, don't overwhelm them. Just get some inputs from them. But on an overall, if you ask me what kind of courses you should do to prepare for your PhD, obviously, as Vrinda said, you should have a good understanding on what a publication is, what type of articles are there, and what type of writing skills you need. Those kind of certification courses you can take. Again, I am saying you don't go with the scam. There are a lot of online advertisement, 99 rupees course or 88 rupees courses and all. I don't think it is very beneficial. Maybe beneficial, but not that. I don't know about the content. I'm not
Yes,
talking about the
yes. We
content,
can't
but
endorse it.
instead, yeah, instead, if you can go through a good established institution or organization, they conduct this kind of certification program or this kind of courses. Even no need to go the, maybe you can, even YouTube is available for everything, or you can go to
Absolutely.
the different, even I learn everything from YouTube.
Yeah, me
So
too.
you go to YouTube and you will get a lot of knowledge from that. Even you want a in-depth brief, it means very comprehensive also there. You need everything should be cut shorted into 2 minutes.
Yeah.
That is also there. So maybe first you hear a comprehensive one, then you just hear a cut shorted one so that you will get the complete essence of that. So you should learn what you need to be prepared for your PhD. So like how to write a review article, how to write a research proposal, how to make a protocol, or how to make a good CV, how to get through the interview. Even I was preparing such kind of things when I was preparing for my PhD. So even that is the general things you should know, or what are the different grant opportunities, or maybe we have ICMR, JRF, then
Mm-hmm.
CSIR, JRF, and all. You can learn about that, how you can crack through those kind of exams. What are the different competitive exams you can get through, and very specific to the area like pharmacogenomics, if you take me, so that you need to specifically work separately.
Yes.
uh, Depends on the area which you are working on. I think that could be and even like same way, if you look at one more question to that part was, how can I look for foreign university?
Yes.
Looking for university, there is no other method. Whatever we said,
We have
maybe
already
around four
covered
to
it.
five methods, everything is covered there. You can put the filter there, you can keep only pharmacogenomics, or you can keep only the genetics, whatever you want, and you can get through that part.
Yeah,
Yeah, otherwise,
absolutely.
I think maybe we can provide some resources for them in
Hmm.
the coming days once we are ready with that. Otherwise, I don't think we can specifically answer for
Yes.
pharmacogenomics, but I think
Yes.
we covered other part of that question.
Yes, yes, yes. So, just to end the conversation, I think it's very important that you find the right people in the field. So many a times, what I see is if when a person finds that someone has done a PhD, they ask all their questions together to them, or they just I receive messages on LinkedIn that just says, "Ma'am, can you just guide me on how to do a PhD?"
Ah, yeah.
So that is a very vague question to ask. So how can I just give you
and
an
and
answer?
and
What are
even
you
some people
expecting
will.
a essay question to me? But yeah, be very specific. Like, do you know any university that gives a PhD in this area? Or is there any specific resource in antimicrobial
Yeah,
stewardship that I can refer to? Be very specific with your questions. Don't, like Rashid, again, he was pointing that out, that don't burden the person to whom you're messaging. We all are happy to help you in whichever way we can. Of course, FCPI is committed to that, but it is just a courtesy to the people, to the person, to the professional that you're approaching. Be very specific and so if you want to ask a question on pharmacogenomics or pharmacoeconomics, make sure that person is aware about it. Don't put the person in a tough spot by asking the question and expecting the answer where he or she may not be an expert in the field to answer that. So that's just a closing comment that I had because we were discussing on these aspects. Anything last final remarks, final comments that you want to add, Rashid?
And I think maybe if they, it's not a promotion, but still I need to say, if they follow the FCPI YouTube channel and they can see to the research and publication forum activities or the podcast like this, they may get good essence of what to be done in their PhD.
Yes,
So that might be not only FCPI is a, many organizations,
of
a lot of
course.
organization does the same. But as an introduction to the clinical pharmacist or PharmD or M.Pharm in India, we initiated these kind of activities. So we are offering these kind of things. So they can follow those things and get an essence. Plus, there is, as I mentioned again, I'm saying, come out of our comfort zone, explore as much as possible. There is
Think
nothing
outside the
doubt in
box.
explore, think outside. PhD is all about think outside the box, or like I said, jumping into a pool without knowing. Because that, I think that was the excellent phrase I could frame after my PhD. So, like you said, one more point, maybe what I do after my PharmD or M.Pharm, I think it's altogether a separate discussion. And I still remember when I was doing my initial days of PhD, I used to keep status in uh, WhatsApp that don't believe the rumors that PharmD don't have job. PharmD
Hmm.
have a hell lot of job. Though
Of
I'm not from a
course.
PharmD, though
Of
I'm not
course.
from a
I mean,
PharmD
clinical
background, but
pharmacy in general,
clinical
whether it's
pharmacist
PharmD,
in
M.Pharm,
general,
whatever it is.
M.Pharm or whatever is because I said I'm not from PharmD. Earlier days, people had that doubt. Should I ask it to Rashid sir? Then slowly, when I got involved with the PharmD students and working for them, they really understood that they can ask me, and they started telling their concern, and this was the major concern which I used to get. So I used to say them, no, you have hell out of opportunity, but you have to create the opportunity. So
Yes.
that
You
is
have to
what
explore it,
makes sense.
actively explore
And
it.
explore it, and when you create an opportunity and get succeeded that
You're
any
creating a
field,
path for
PhD,
others also.
others also, and you can really taste that essence of success. And I
Yeah.
always believe luck without effort or without your effort, they will not have a taste. It will be bland food. But luck should be there, but meanwhile you have a effort, then it will be
Yeah.
more tastier. So
Yes.
that might be the closing comments from
Yes.
me. I think we
Yes.
are
Thank
almost take half an hour extra,
Yeah.
but I
Yeah,
think it
but I
will be
think it
fun.
was a good discussion, and we have
Yeah,
covered at least the basic aspects of PhD. PhD cannot be covered in 1 or 2 hours.
yeah,
It's
obviously.
it's a whole thesis in itself. So, but I think this could be a starting point for those who are interested in doing a PhD. So, listen to what we have said, and definitely our intention was never to discourage you in any manner,
Yes,
but
yes,
this was
yes,
just
yes.
the reality of doing a PhD because both of us have experienced it. So, please,
And
yeah. So sorry, go ahead,
we are we
Rashid.
are we are sorry, we are still open. You can always reach out to in, like I said, pharmacogenomics. Myself or Vinda may not be the apt person to answer your query, but definitely we will reach out, get back to you with adequate resource on that. Even myself or we
Yep,
will
yep.
sit back and get back to you. Yeah, we will not leave that question as said, but we took what we can answer from that,
Yes,
but what we cannot answer, definitely we will be reaching
yes,
out back to you with adequate resource for that. And FCPI is always open as a administrative level operator, we both. So FCPI is always open for your questions, queries, and you can also tell us what you need or what you are expecting from us so that we can align our
absolutely.
sessions and other things towards that. Yeah.
Right. So, thank you so much for listening, and we hope that you were benefited from this very long discussion. Definitely reach out to us if you have any specific questions. Please do some background work and frame your questions adequately so that we are in a position to help you better. So, thank you so much, everyone. Have a good evening, and I hope you have a very productive